Welcome to our webinar series for professionals.
Welcome everybody to this webinar on DNA pain with Helen Gautschi. I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, where we focus on functional medicine and personalized medicine in regards to different symptoms, health challenges, etc. And today the focus is pain and how we, based on the information we get from our genetics, can put together treatment strategies for patients with chronic pain. And here we're talking about lifestyle and diet interventions as well. So we are having some busy times at the moment. It's time to do conferences and events around the world. We have a long list of things we're going to participate in. And at the same time, we do still offer webinars. So, and the next one is on the 6th of October, where we have a guest that will talk about stress and HPA and supplements, etc. So I hope you sign up for that one as well. But Helen is going to present today the DNA pain test that we have just launched together with Jeff Ballon, a chiropractor that's very interested in functional medicine and lifestyle changes in relation to treating his patients. So him and Helen and the team behind the DNA pain have been working real hard to get a very nice layout ready for you so that you can start using this test in your clinic if you have patients with pain. So Helen, I will let you take over here and do your presentation.
Okay, thank you so much. And thank you. I appreciate your patience, everyone. I hope you find this as valuable as we found enjoyable putting this test together. So getting into it today, what we will be discussing is obviously the launch of our new test, DNA pain, and going through the DNA test report overview. So really just discussing the why, the what, the when, and a little bit about the how of DNA pain and why it's so important to see when seeing patients in your practice who are suffering from any kind of pain conditions and their comorbidities, to consider this DNA pain test. So just getting into what is DNA pain, we are looking at genetic variants. So it is a genetic test specifically focused on the nutrigenetics, nutritional genomics side of genetic variation, and understanding where variations in genes involved in key biological processes from oxidative stress to inflammation, methylation, as well as cell signaling, your neurochemical pathway, your opioid pathway, as well as your endocannabinoid system, to name a few. Some of them you may be familiar with already, where we might see weaknesses in these pathways because of genetic variation. We can then identify how we can offset those weaknesses through either changing gene expression with nutrigenomic interactions, or by bypassing specific areas in the pathway, understanding the mechanisms behind the gene at play. And this is where the use of our diet, our lifestyle, supplementation or nutraceuticals, physical therapy, exercise therapy becomes so important in really being able to enhance our pain management interventions. So why was this test developed? Well, we were speaking with Dr. Jeff Ballon and Catherine already mentioned. So he's got these he's part of these clinics, neuropath in Canada and across Canada, and in some other parts of the world as well, where he has really or came to us identifying patients that maybe weren't doing as well as they should be, and looking at how we can overall improve the management of chronic pain, how we can start identifying where their weaknesses might be, kind of the underlying causes of a lot of the issues, to start targeting treatments for overall improvement. So getting into sort of what chronic pain is and why it was developed in a bit more detail, I'm sure if any of you have gone through any kind of operation, procedure, been in any kind of trauma, had any kind of traumatic injury, sports injury, suffered any kind of pain, I mean, even stubbing your toe, you know the level of frustration and angst that it causes one. So now imagine that pain, persistent or intermittent, lasting for more than 3 months. That can then lead to significant suffering, social isolation, disability, major costs, both personally and then on the healthcare system. And what is so frightening is that, in fact, 1 in 5 people globally do suffer from some form of chronic pain, and that features prominently in the top 10 causes of disability. So a really big focus of where we need to start addressing our attention. How can we start improving the management to improve the outcomes for chronic pain sufferers? And so whilst injury or a disease may be the primary cause of chronic pain, only a small minority of individuals subjected to those kinds of injuries eventually go on to develop chronic pain. And this is where we understand that chronic pain conditions are complex. It's a multifactorial disease. It's a result of an interplay between an individual's environment, their lifestyle, genetic makeup, which influences the duration, your intensity, the perception, and the effects of chronic pain. And these effects also include your physical, your psychological, your social, and your emotional. And so understanding all those facets means that you need a multifaceted approach to the management. So currently, chronic pain management treatments are associated with a lot of negative side effects. So when we're talking about the typical chronic pain management treatments, we're looking at a lot of pharmacological treatments, and those are associated with negative side effects. So your NSAIDs, they put a major burden on the kidneys. Your opioids, there is the addictive side, and then also looking at variable levels of effectiveness and responsiveness. So at that population level, if we're not looking at genetics, we know that some individuals respond really well and some don't. And that's again why we need to start considering that genotype individualized approach to pain management, both from the pharmacological side as well as then going into the multimodal side, looking at non-pharmacological treatments. So this being a very good test, and when you're looking at patients in your clinics, to consider this alongside your pharmacogenomics testing of MedCheck, because you need both sides of the picture when treating. So why, of course, now we understand that that treatment in terms of current treatment regimens haven't always been as effective. And so we need to start looking at evidence-based non-pharmacological treatment approaches, including nutritional and dietary modification, your physical training exercises, cognitive and behavioral mind-body techniques, and all of these are becoming very widely used in practice. In fact, today I read an article just to pop up about from NHS and how they're moving away to support really the burden on the NHS of our doctors trying to prescribe other treatments, lifestyle treatments that are going to really start supporting health and preventing disease, and not just looking at your typical more mainstream approaches. So considering these non-pharmacological approaches, these have improved mobility and function, so great evidence around that. And it's been shown in patients with chronic pain also to simultaneously reduce the risks and impact of your common comorbidities, such as a lot of the mood disorders, the anxiety that goes along with chronic pain conditions. And so where we come in as DNA Life is looking at the genetic variants related to identified biological pathways, which are of particular interest when considering a personalized approach to pain management. It's due to their involvement in the predisposition to chronic pain, pain sensitivity, so the heightening of pain when stubbing your toe is a very basic example, and then also those related comorbid psychiatric conditions. And there is strong evidence to support a genotype environment phenotype interaction in the context of chronic pain predisposition, and then responsiveness to various multimodal therapies. And when we're looking at these multimodal therapies, of course, we want to incorporate all of it, but it becomes quite difficult for the patient to, if you start looking at some of the guidelines around that, there is a lot to start trying to adopt as a patient suffering. And so by understanding where your weaknesses might be, you start to target that approach. It becomes less of a burden for the patient to adopt those those different approaches. And because you're adopting a targeted approach, you know that where you're going to be putting in the effort, you're going to get the best responsiveness as well. And this is the whole concept of looking at nutritional genomics in the context of chronic pain. And so I just wanted to go over a slide that might be familiar to many of you, might just emphasize the importance of this field and really where we're working in terms of chronic pain management. So when looking at nutritional genomics, there are two sides of one coin. One side being nutrigenomics, the other being nutrigenetics. When we're looking at nutrigenomics, this is where, by understanding where weaknesses might be, or looking at interventions that we put into place, we now are able to understand why those interventions working. So nutrigenomics focuses on how nutrients or dietary components affect gene expression, protein, and metabolite concentration, and how this then affects health, status, weight management, pain management. As an example, I've used when we are recommending fatty fish, omega-3 fatty acid supplements, good quality forms. Why are we recommending them? Well, one of the reasons is because if you have a higher expression of this pro-inflammatory cytokine, your TNF-alpha, that means that it's going to lead to it's going to lead to increased risk for chronic pain conditions. So high TNF-alpha directly associated with increased chronic pain sensitivity. And so when we put in the omega-3 fatty acids, what we do is we actually suppress the ability for TNF-alpha to be produced in such high levels. And so by doing that, we decrease, or we start to moderate or improve the outcomes for chronic pain. And what we want to know on the other side is if we have a genetic variation in, say, this gene. So looking at a genetic variation on TNF-alpha, if we carry the GA or AA genotype, we're going to get, say, a 3- to 4-fold increased expression of this gene at baseline. So now take me, who has an AA genotype, and someone else who does not. We both get exposed to a trauma, and then we start to feel the effects thereafter. And my predisposition to developing chronic pain is so much greater because of that AA genotype at baseline. Now it's just going to shoot up much higher. And on top of that, if my lifestyle is that I'm overweight or I've got a high pro-inflammatory food intake, it's further going to exacerbate those chronic pain outcomes. And so understanding if we've got this variant, we now know that especially looking at something like omega-3 fatty acids significantly reduces the expression of this pro-inflammatory cytokine, and that then leads to much better improvement in chronic pain outcomes. And so this is really a concept that we want to highlight when considering all of our nutrigenetic testing, our lifestyle genetics, and in the context of chronic pain, how it fits in. And so DNA pain will provide insights into these key biological pathways for improved and sustainable management of chronic pain. So getting into the report, what you will receive, well, if you are familiar with our tests, you may start recognizing a few of these pathways that we are reporting on in DNA pain. But every time that we report on one of these pathways, it is very specific to what we have found in the literature around pain management, from musculoskeletal to your neuropathic pains, fibromyalgia as well coming through quite strongly. And there are some genes that you may be familiar with within these biological pathways, other genes that are completely new and very specific to pain management. So starting off, what you will see is this results summary page will come up in the report. And from there, you will start to see and quickly be able to identify. This is based on an algorithm that we produce from the genotypes that an individual is carrying. And you can then identify where you have, or where an individual has a high priority outcome. And that is where you want to focus your attention. So it becomes very easy to start recognizing where you need to focus, where you need to target your interventions that we then provide in the following pages. So for this individual, we now see that we want to really focus on cell signaling, the neurochemical pathway, and the opioid pathway. Those are going to be the bigger weaknesses. Then followed by methylation and oxidative stress, and also considering in the more detailed training that we will have available to you that there can be a sort of a gene on gene effect as well as a pathway on pathway effect. We know that high inflammation can hinder methylation functioning, which can then alter cell signaling. And so very important to always keep this in mind, that one does need to keep in mind the compounding effects of pathways, but also really helpful for you to be able to understand where you need to target your attention. On the following page, you will actually see this page where you will see the summary recommendations based on where your high and moderate priorities come up. And this is actually extracted from your gene and genotype content. So looking at the biological pathways that we give you. So this is the detail for those of you who enjoy seeing the detail, the actual genes. Why we included these genes is because of our strict SNP selection criteria. And then we assign an impact factor to each of the genotype results that could be possible for each of those variants that we are including in the test. And so when you are seeing a moderate or a high impact factor, that would then translate into, if you get a lot of those in one biological pathway, it would then translate into these either moderate priorities or high priority areas where you need to focus. So that hopefully helps to just make sense of the genotype results leading into the result summary. And then something that I think is just so helpful for both the practitioner and the patient is being able to have a one-pager summary recommendations. And this is based on great evidence to support each of these biological pathways, where there's also looking at evidence to change gene expression that of the genes that we're testing in these pathways. And also, interestingly, some of these specific pathways have been related to specific types of pain. And so that has all been incorporated into these this result summary. And so in these recommendations, they are focused on how we can improve oxidative stress through diet, through nutraceutical recommendations, specific exercise therapies, and remembering a lot of the time that individuals who are suffering from chronic pain are not going to be the most mobile of individuals. So looking at what we can achieve through specific exercises, and great evidence coming through on that. And then also lifestyle and types of lifestyle management that we need to incorporate. And so this is something where you can work through with your patient. Where are they at currently? What have they been able to achieve? And what can you do from the diet that you can highlight one or two steps, highlight some of the first few nutraceuticals that they could start incorporating, or maybe eliminate some of the things that it's just too much. And then looking at the exercises, a step-by-step process on that, and then highlighting the key things in terms of lifestyle that you would want to also introduce. Something else also that's great about this page is that obviously you can provide the full report to the patient, but what's nice is that this is something that they want to know what to do with the information. Obviously, understanding the why around the genes and the pathways is interesting for some, not all, but understanding what to do. How can I make my life better is so important. And this is where this page can be put next to their bedside table, stuck onto their refrigerator for constant reminders on how to improve their outcomes. Then when we get into the body of the report, I'm going to go through each of these areas, just highlighting what you would receive. But based on what we've seen already from these recommendations, these priority areas, we then go into the detail to be able to see what are you actually going to receive in terms of information that you can use right there and then on hand. And so in the body of the report, you will see that each of the biological areas are described in detail on their own. So starting off with oxidative stress, you would get a description of that biological area in the context of pain. You would then get the genotype results relevant to that biological area highlighted again. So it's easy access. You don't have to start flipping through pages. So very user-friendly style in terms of report formatting. The priority level of the biological area is then given straight afterwards. So that summary is right there for you. And this is a detailed recommendation then to support both genes as well as the related biological area that we are speaking about. And then lastly, I think that is what is so important is you want to be able to measure as much as possible. So being able to see, yes, this person is suffering from chronic pain. This has come up as a high priority area, being oxidative stress. What do we start doing about it? Well, we start putting in these interventions looking at specific antioxidant-rich foods, maybe looking at some things around your superoxide dismutase supplementation. But then you want to be able to measure is it working. So being able to do some of these next step tests would create a really holistic picture on what is happening here and now, what the intervention is going to be that you put into place, and what can you then do in 6 months' time to start seeing, okay, well, where can we see the improvements coming through? And so these next steps all relate, in terms of the functional testing, all relate very clearly back to the biological area in which we're reporting it. Then on the next page in the report, following the biological area information, you will receive the gene and genotype specific information. So going into the detail on what the gene is all about, and then what does that genotype mean in the context of this patient for chronic pain. So all really nicely explained in the report. We do have a lot of external additional resources available to you, but this is something that is just all there in the report for you. So if you are able to, if you just go through this information, you will hopefully feel very comfortable with what you can provide for the patient and interpreting this test for the patient as well. Then what we don't provide in the actual report, this becomes too much to put into the report, but this is where we have extra training available as a separate online course for those of you who are seeing a lot of these patients in your practice. If this is a special interest of yours, I really would highly recommend doing this online course that we will have available from next week. And what this then goes into is the background of each of the biological areas in more detail, explaining why oxidative stress was included in the test. And so the science behind that is really well established. And then each of the genes is also given in a lot more detail. So looking at a gene that is completely new to all of us in DNA life is your FAM17.3 beta. It's actually one of the enzymes that transfers a methyl group to a number of enzymes, including your ATP synthase enzyme. And when this gene is hyperexpressed, or when it's working too hard, it actually has this ability to increase your superoxide production, your radical oxygen species production, activating glial cells, and then promoting persistent inflammatory pain. And this is, so when we're looking at each of the genes that we're including, we want to understand the real mechanism behind it, because then we can start understanding, well, where can we target the interventions to really see a difference in our pain management outcomes. And what we then start looking at, and this is what we spent the last year really consolidating, is the background, the genetics, and then what do we do about it? So the interventions for the treatment of chronic pain, specifically now looking, because we're considering oxidative stress and inflammation, highlighting the importance of oxidative stress in chronic pain, specific dietary influences that were recommended, sometimes a low carbohydrate, but also Mediterranean diets have shown best influence on really attenuating inflammation, as well as managing those oxidative stress outcomes. And so this is all based on what we've been seeing in the literature that then translates into those recommendations that you saw on that first page of the oxidative stress section. Moving on, we would then, what flows quite easily is inflammation, and again, considering oxidative stress and inflammation very tightly bound to one another. In this individual's genetic variation results, not a lot coming through, and so this would then be baseline that you would want to support in terms of inflammation here. But then, we would obviously assume that every individual suffering from chronic pain suffers from, there's an inflammatory response happening. But the biggest target in terms of the genetics comes from targeting oxidative stress, and thereby it would sort of be a downstream positive effect on improving inflammation outcomes. Again, with methylation, this is the next section being reported in the test, more in the body of the report. This is what you will see coming up. Again, an explanation of the method of methylation would be given. Methylation was specifically included because it plays an essential role in neurotransmitter synthesis, which is extremely important in mood regulation. And what has been so interesting with looking at these studies is that poor methylation function, both due to enzymatic deficiencies, low levels of vitamin Bs, are associated with risk of mood disorders. But the biggest relationship comes in here, why we included methylation, is because of its strong relationship with chronic pain in its mood regulation component and drive or kind of control over mood regulation in many ways, is that individuals who are suffering from chronic pain are 3 times more likely to develop a mood disorder than those who do not suffer from chronic pain. Interestingly, this is also a bidirectional relationship. So people who are at risk of depression or are depressed, have anxiety disorders, are much more likely to start suffering from a chronic pain disorder. So very important to make sure that you're supporting both sides again here. One study showing longer duration of rumination. So that's kind of just like how I kind of imagine it's a rumination, kind of wallowing in the negative thoughts of the day, of everything negative around one's life. That is also linked with a higher pain sensitivity and mood disorders, and that all being linked to how we promoting and producing these very important neurotransmitters. And so when methylation does become a priority, we want to focus on it through the dietary, lifestyle, nutraceutical, exercise interventions, and then also be able to measure what is happening at the here and now. After the interventions, we want to test again with those functional tests. So that is why methylation was included as such an important pathway in this test. Moving on then to another cell signaling, we're now looking at a potassium channel signaling pathway, where we're looking at the importance of cell signaling and excitability in actually causing chronic pain. And if there's too much or cell signaling is almost on hyper alert, the excitability is on another level, that is actually related to very highly sensitive neurons, nerve endings, and also being related to increased risk for chronic pain. So this is a new one that is included in our test. And the evidence behind this is really good, where we've looked at this gene involved in chronic post-surgical pain, but also neuropathic as well as osteoarthritic pain. It comes up with systematic reviews, meta-analyses showing the importance of including this SNP in this test, and how understanding if an individual carries a variation on this gene, the risk for developing chronic pain is higher. So in terms of being able to get realistic expectations of your treatments, realistic expectations of someone going into surgery and coming out of surgery with longer pain duration. This is a very important SNP to consider. And so being able to do as much preemptive work as possible, supporting all the pathways, decreasing inflammatory pathways. And there's some specific guidelines specific to cell signaling around your omega-3 fatty acids coming in there. Some of your methylation genes, your methylation nutrients, very important here as well. That's shown to support this area. So also very important to consider cell signaling in preemptively decreasing risk for chronic pain. Looking at the neurochemical pathway, this should be familiar to you if you are using both our dnapain as well as resilience tests. But now again, looking at these genes in the context both of mental health, but also now how it relates to pain specifically. And this area coming up as a high priority. The neurochemical pathway will be explained in more detail, again highlighting you get all of this information specific to how to support this pathway and how to increase expression of both NPY and BDNF, because you want those being expressed in higher amounts. Giving a little bit of background, which you would get in the more detailed training, showing you actually now looking at NPY and its importance in traumatic brain injury. It was from this specific article, where we show that good increased expression of NPY helps with increased proliferation of our neurons, maturation, differentiation, functional integration. So the talking is much better. Beta angiogenesis, so beta blood vessel growth, and then modulation of your neurogenesis as well. So being so important in healthy kind of neuronal signaling, and also decreasing pro-inflammatory cytokine expression. So high NPY is very important for decreasing your pro-inflammatory cytokines, which we know are increased during chronic pain. And so how this works, well, how we would increase the expression is looking at your gut health and ensuring things like your deep breathing comes in there, your B vitamins for proper methylation of this gene becomes very important as well. Then going into almost the last one, looking at serotonin, this being related both to chronic pain as well as mood regulation, and so important to consider again serotonin signaling, and this is a very important receptor that we do report on in some of our other tests, but here specific to how it is related to chronic pain. This didn't come up as a high priority, so it wouldn't be a big focus, and so it's personalized in the report for you. Two more to go. So catecholamines, looking now at both your receptor, your dopamine receptor gene, in terms of mood regulation, but also sensitivity to chronic pain, so pain sensitivity, and then also looking at your COMT, which is related to your mood disorders. It's associated, or it's responsible for breaking down your dopamine, but also your adrenaline and noradrenaline. So if we've got a lot of these excitatory neurotransmitters sitting around for too long, and we don't have the and we have a variant that maybe makes the enzyme slower than we would like, this leads to a lot of altered perceptions in pain management. These also being related to actually almost responsiveness to pain management medications. And then interestingly, depending on the variant that you might have, some placebo effects around pain management. So very interestingly, when we're looking at both COMT as well as the opioid pathway, and the next one that I'll be speaking about, a very important component of this test is understanding placebo effect. And we all know that placebo effect is real. It's just that some people actually have a much higher placebo effect compared to others. And it's because they know that they are being taken care of. Their doctor is looking after them. So very important to have very positive interactions with their medical supervisors, all medical staff, because a positive experience for certain genetic variant carriers actually leads to better pain management outcomes just through that placebo effect. So very, very important to keep that in mind. On top of that, when looking at OPRM1, we know in terms of responsiveness to our opioids, it's very important. Looking at risk addiction, we want to make sure that this is being covered. So if opioids are going to be prescribed, there is a place for them in certain situations. But again, doing those opioid risk assessment scores, because that becomes so important when actually considering if you are going to be prescribing opioids. And then also looking at individuals who do carry the variant, there is an increased risk for chronic pain and higher pain sensitivity. And so this, just looking at some of some of the articles that and some of the research papers that are reporting on this opioid receptor and the importance of it in chronic pain management. So because it comes up as a high priority, you definitely want to look at how we can intervene through looking at different analgesic options, looking at different multimodal approaches, Tai Chi specific to this, looking at how it can actually improve your own opioid production through actually doing Tai Chi and some other exercises. So very important in terms of opioid management. And then lastly, a very interesting pathway that I thought was just, again, in terms of the placebo effect coming through really strongly, looking at your endocannabinoid system. This enzyme is, FAH is encoding an enzyme responsible for breaking down one of your own endocannabinoids, important in pain sensitivity, but then also the placebo effect. And then for carriers of the A allele, having a higher risk for anxiety and mood disorders, post-traumatic stress disorder when having experienced a major traumatic event. So for individuals who have gone through a trauma leading to chronic pain, together with those comorbid conditions, you really want to consider how we can improve this pathway. Things like looking at your fatty acid levels in a functional test would be very important, because those are so important in modulating your endocannabinoid system. So those are the pathways that are reported in the DNA pain test, all summarized into a succinct page of recommendations based on where your high priority levels come up for every patient. And then when considering who to really do this for, I hope it's become quite clear, but to highlight again, those suffering from musculoskeletal or neuropathic pain, patients coming to you suffering from arthritis, both rheumatoid as well as osteoarthritis, your fibromyalgia patients, each of these genes in this test have good evidence relating back to fibromyalgia. So a really nice one to always keep in the back of your mind if you are seeing those patients that are very difficult to treat sometimes. Any preoperative patients, again, when it comes to things like cell signaling, your opioid response, preemptive is much better than trying to catch up at the end of the day. And those who experience any kind of previous physical trauma, sporting injuries, things like that, you want to try again and catch it as early as possible to prevent chronic pain from actually manifesting. Some important test pairing to consider: the functional and biochemical tests that are recommended in the report according to the priority area are just really easy ways to make the kind of conversion happen, the translation of what is happening in the genetics to actual biochemistry, and then you get a really good understanding and picture of your individual. And then, of course, looking at pharmacogenomics. So we're looking at DNA pain from the nutritional genomics perspective for managing pain, and then the pharmacogenomics looking at the pharmaceutical perspective for managing pain, decreasing risk of side effects, and making sure what you're taking is as effective as it can be. In terms of further learning material and supportive material for you, we have the team that you can always get in contact with if you've got a DNA pain report that you'd like to order, or you're thinking of someone. We'll always run through that report with you beforehand if you would like us to. We will then be sending through what will be available as a DNA pain white paper, going through all of these areas in a lot more detail. It's just a major literature review of everything that's been included in the test. A SNP guide, so that's kind of like your DNA Life Bible of genes and gene variants, will be available for this test. And then, of course, as I mentioned, the DNA Pain online course for those of you who really want to become sort of the preferred provider for this DNA test, and have a lot of patients that you have in your practice that you think that would really benefit. This course would be great for you to go through in more detail. So that is just an overview of DNA pain, and being able to hopefully provide you with sustainable pain management and risk for your comorbid disorders. Thanks so much for your attention.
Super, Helen. So yeah, this is kind of like an appetizer for those of you who wish to dive deeper into working with pain management. And yes, the online webinar, like we have for Resilience and we have for DNA Smile and Grow Baby, will be offered like in the next coming weeks, so that you will get that invite as well. So it's just really to wake up your appetite for what should we put on the wish list for your educational hours that you have on the side. So a few questions came up. One was persistent in regards to, I'm going to pronounce it, but it's probably more Danish the way I pronounce it, trigeminal neurology. If you've come across any research for some of the genetics or the genes and trigeminal pain. Now we can't hear, well, I can't hear you.
I muted myself, sorry. Okay, so in terms of that research, it would be, it would be quite early, especially because if we're thinking about, well, although the trigeminal neuralgia, that would be related to overall the neuropathic pains that we are reporting on in the test. So there are specific recommendations included in this. We have some articles that I think were very specific to things like very specific neuralgias, very specific surgeries, that we did include, but it wouldn't have been the only article. We wanted to make sure that if that was sort of a very niche area, that there were other relationships with pain management and the same kinds of things coming through for overall neuropathic pain, and so that we weren't just going to be able to treat a very, very niche market and no one else. But definitely there are genes involved there, the cell signaling, very important, as well as, again, that one around oxidative stress. So your FAM17.3 beta, very important in that area as well, and related to neuralgia. So it is reported. I think we actually discussed an article that we will make available.
And you can order it. It's in the system already now for you to order as a standalone test or as an add-on if you order like any 2 or any 3, if you want to combine it with DNA health and pain and resilience, maybe, just to mention a few. So it's there already, and the information and education and so on will follow as well. Then one asked if you've come across any specific supplements in regards to helping cell signaling.
Yes, so in terms of the cell signaling, I mean, it would be in the report. Obviously the brands wouldn't be available, that we don't give, but in terms of the specific supplements for cell signaling, it's actually a lot around your omega-3 fatty acids. And then your B12 was shown to be very important as well. So those two coming through quite strongly. And then just supporting overall electrolyte balance seemed to be something that actually made a big difference as well. So dehydration in terms of cell signaling can actually increase pain sensitivity. So
interesting. So, and then a question came up, and I'm just going to say what time it was. It was 1640 about call 5A1 and 5A2 and call 1A1. I didn't really understand the question, but you might be able to pull out the gist when you read it.
Yes, so these genes definitely in terms of, so call 5A1, call 1A1, all of them are components of your collagen. So for different parts of your collagen chain, these genes encode for different parts of your collagen chains, and very important when considering injury risk, injury susceptibility. When looking at pain specifically, these SNPs didn't translate into the pain side, but more kind of on the injury side. So this is where both for COL5A1 and COL1A1, these are included in the DNA spore test. So if you are seeing individuals who have experienced some kind of a physical injury, I would recommend combining DNA spore together with DNA pain, and that would be a very nice test pair that I would recommend to do, because the information in terms of how to improve the production of those genes, how to improve the functioning of those genes, that is included in the DNA spore test.
And just if you have kits lying around in your clinics already, you can use the same blood spot kit for this one. So you don't need to order new kits in order to start using it if you already have kits. And if you don't, we will, of course, drop ship the kits. I'm not sure what the offer will be on the course. I'm quite sure it will be the course, and then you get a test in that price as well. So because we tend to do that to encourage you to do it on yourself or a patient, and yeah, so you get hands-on right away from as quickly as possible. Then a question came up in regards to pain due to Lyme, and then I'm just going to go from the Lyme side and say, well, Lyme can cause different types of pain. It can be neurological pain, it can be muscle pain. Yeah, so it can be different things. So I guess because this test is quite broad in regards to pain, that it would be relevant. But of course, I don't know if you've been through like Lyme pain research and the genetics.
So I think your comment, and Catherine, I think sums it up, is that Lyme can cause so many different types of pain. Often that's almost linked to something like fibromyalgia. And so when we were looking at the research, we didn't specifically look at pain induced by Lyme disease specifically, but I think one would be able to translate the concepts of, when we're looking at neuropathic pain, musculoskeletal, and then also, with Lyme disease often comes, it's or post-Lyme, it's the gut health, and also the comorbid conditions, the mental health component, which are all reported in this test. So I think by using the information and understanding the pathways to support the pathways, and knowing how they relate to many different types of pain, you would be able to support or improve the management of the chronic pain. But again, when it comes to Lyme, I think it's almost treating that as well, and the issues that manifest because of the Lyme.
Super. So one just missed out on the kits. I have a kit right here with me. So it's just a normal DNA Life kits. Last year, I think it was in August, we changed from buccal swab to blood spots. So all test kits shipped out the last year has been blood spots. But if you still have a buccal swab that's in a silver foil bag and has not expired, then you can also use that. But we don't ship out the buccal swabs any longer. We just use blood spot. But yeah, it's still possible to use them as long as they haven't been expiring. And the reason why we changed is because blood is a much more reliable specimen than buccal swab. So we just changed because we didn't want to. We want to be able to report as precise as possible, and not leave out genes so that you end up not having knowledge about a gene on the report. So that helped tremendously, swapping over. So yeah, and it's like no one has really been complaining about it, but of course it's a little bit more having to prick your finger than doing the buccal swab. But yeah, we have to choose what's most correct and how, so that we get the most correct results out of the reports. So yeah, many like different things are coming up on treatment, microcurrent, neurofeedback, etc. And I think all this is, we're just opening up, and I think follow us and do the course, and then through that we can see what the response is, and you can ask questions to us, to our support team, and we can support you on the line if this is something that will help you. But it's great to see how so many of you already are working with pain and focusing on pain, and hopefully this will become a tool for you in your clinical practice to help your patients even further, or help some of them in a different way than you've been able to so far. So but education first and then clinical practice after. So Helen, as always, you have created an excellent presentation, and I'm just hungry to get more knowledge and learn more about this test. And thank you everyone for your patience in the beginning of the show. But yeah, everyone stuck out, and I think it was definitely worth the wait. So reach out to us if you need support. We will send the recording, we will send the slides, and we will send invites to the further education as well as soon as we have that ready. So, but stay close to us, reach out if you need support. We are always eager and happy to support you as much as we can. So thank you everyone, and thank you, Helen.
Thank you so much. Thanks everyone.
Bye.
If you do not already have an account with us, please contact our team and we will assist you. If you found this webinar helpful, please like and subscribe to our channel.